Thank you, Mr Deputy Speaker. Our government would firstly like to thank the community for their support for the establishment of the Royal Commission into the aged care sector. And I know it's an issue that's been raised within my electorate of Dunkley, whether it's been in my local aged care facility visits or across the community, as well as in the wider community across Australia. Around 5,100 submissions were received from aged care consumers, families, carers, aged care workers, health professionals and providers. And I'd like to thank the Minister for Aged Care, as well as the Prime Minister, the Cabinet and others for their significant work bringing about the Royal Commission. This is indeed, Mr Deputy Speaker, a vital step for Australia to determine the full extent of the problems in aged care and to understand how we can meet the challenges, as well as the opportunities, of delivering and improving upon aged care services now and into the future. It is also about helping to build a national culture of respect and increasing respect for ageing and our senior Australians. And I know some of the issues that I came about through my own grandmother's experience, as I've mentioned in this place recently, were of concern to me and bring about a personal understanding of some of the issues that people in aged care facilities go through, as well as people in retirement villages and other sectors related to that. I note that many people in the aged care sector and in our retirement village sector do a great job, but there are those who are doing the wrong thing, whether they are individuals or certain elements within the aged care sector. I note that on the 9th of October 2018, the Prime Minister announced that the Governor-General had issued letters patent establishing a Royal Commissioner into aged care quality and safety. And I would like to note now some of the issues that the Aged Care Royal Commission will look into. Firstly, Mr Deputy Speaker, we'll cover the quality of care provided to older Australians and the extent of substandard care. It will cover the challenge of providing care to Australians with disabilities living in residential aged care, particularly younger people with disabilities, which is an important element that we should not forget. It will also cover the challenge of supporting the increasing number of Australians suffering dementia and addressing their care needs as they age. It will cover the future challenges and opportunities for delivering aged care services in the context of changing demographics, including in remote, rural and regional Australia. And it will also address any other matters that the Royal Commission considers necessary. Now, we know that aged care issues have gone about throughout governments now, whether it is in the 6 years of the Labor government between 2007 to 2013 or the over 5 years of the coalition government since 2013. So these issues have gone across governments, and I know that, to be fair, both Labor when they were in government and the coalition when we've been in government have been working to address these issues. But concurrently, we need to go further, which is why the Aged Care Royal Commission has been brought about. We need to look deeply into the issues that we can't necessarily just bring about through regular conversations. We can bring about the opportunity to speak to people on a privileged basis as well, to see what are the major issues facing the sector and where can we better address them. And I'm very proud of the actions of our government in launching this commission into aged care, particularly when I hear some of the things that we've heard, for example, from my constituents, or some of the things we've seen on television or in the newspapers, not only over the last few weeks, but over the last decade or more. And as I said before, I know from my own family's experience some of the issues across both the retirement village sector and the aged care sector. As I've said previously, I wish that my own grandmother had the experience of some of the great places in my electorate, like the village Baxter in Frankston, which has a very strong model and management and has shown the ability to truly care for residents. I also had the privilege of going along to village Baxter on the weekend. They had, at the conclusion of Seniors Week, an opportunity to have an open day and fete at the village Baxter. I brought along my family, my wife and my daughter, to see some of the facilities that they had, but also to participate in some of the activities that they had there, with also the involvement as well, I should acknowledge significantly, of the Mount Aaron College, which is nearby, and the number of students who were involved from the neighbouring school on their Saturday, which is normally their day off from school, should be commended. And I thank the Minister for also coming down on a number of occasions to speak about aged care, whether it be in aged care forums or visiting a number of villages within my electorate. I'm proud of the government's actions in this regard, in terms of the actions we have taken to improve the aged care sector, but also with respect to the Royal Commission. And I thank the Deputy Speaker for the time to speak on this today.